And a very good morning, good afternoon, or good evening, wherever you are. It's early here in Geneva, Switzerland. I'm Alexandre Pascuto from WHO HQ. Welcome to this webinar series on geo-enabling the health information system, programs of interventions, regional training workshop for Asia Pacific. This series is hosted by the UNICEF East Asia Pacific Regional Office and Moru Tropical Health Network with the support from TechNet 21. We'd be happy to know who's with us today, so you can already introduce yourselves in the chat box and tell us your name and where you're from. Also your organization if you want to. You can also use the chat box if you need any technical support, if you have any problem with sound or anything else, and I'll do my best to help you. If you have any question during the presentation, please use the Q&A box. It's available at the bottom of your Zoom window. Ask your question at any point of the session, and the panelists will answer them during the Q&A session after the presentation. Finally, this session is recorded. We'll share with you the links to the video as well as the slides by email later, probably early next week. I hope you'll enjoy this session, and I'll give the floor to Sunny. Sunny, the floor is yours.
Thanks, Alex. Colleagues, once again, welcome to this section of this webinar. And of course, we are excited to have you join us today. We'll start with the objectives. My system got frozen. So basically, we are happy to have you join us today, and we have prepared this as a section to ensure that we across the globe join us, and also to ensure that we are able to deliver good quality workshop. And of course, going by the agenda, we will start first of all with the high-level objective of the webinar, which will probably to disseminate operational guidance, and that should be able to assist you in your programs across the globe on what you are working on. More specifically, we hope to demonstrate the potential of the geospatial data and technology in public health, and also introduce the HIS enabling framework and its implementation in your countries. And more specifically, more importantly, we hope to transfer knowledge, expertise, and resources that should be able to allow you to implement the health information system geo-enabling framework in your respective countries. And at the end of this workshop, we expect that participants will be able to have a better understanding, a better grasp of what geospatial data and technologies can bring to your programs in your countries, and how to use the geo-enabled health information systems in a sustainable way to optimize your programs in countries. Please kindly note that this actually is not a GIS training. For the schedule of this series of webinars, Alex rightly said, we've organized this in a series of 6 modules, which will be delivered every two weekly, starting today, July 19th, up to September 2024. And it's tailored to start from the foundations to build capacity, give you insight and exposure on what is needed to sustain your programs. And we ensure that it will be good for you to attend the various sections for you to be able to be equipped with the skills and knowledge to implement the HIS Geo-enable framework at the end of the entire series of workshops. And we'll be able to receive the UNICEF certificates for those who are able to complete the training. With that, let me quickly invite the Regional Health Advisor for UNICEF EAPRO, Dr. Basu, to give us a few remarks before we start the training proper. Basu, please.
Thank you, Sunny, and I hope everyone can hear me well. So quick just to say all of you, to invited government representatives, colleagues of collaborating partners, and all participants. Very pleased to welcome you to this regional training on geo-enabling health information systems, programs and interventions for the Asia Pacific. We do recognize that there are competing demands on your time and therefore wish to thank you for being a part of this event today and hopefully the ones coming forward in the future. Geospatial data and technologies have been and will continue to play an important role in strengthening primary healthcare, especially in the design and planning for healthcare service delivery. Geospatial data, including population estimates and distribution, health facility locations, boundaries, and travel time, among others, is used to develop an actionable geo-enabled microplan, among other things, including for organization programs. Despite the benefits of using geospatial data and technologies in microplanning, these tools are not always straightforward nor easily adopted in all contexts. Nevertheless, geo-enabling the microplanning process provides opportunities to address systemic challenges and establish capacity and assets beneficial across the health sector, such as improving population distribution estimates and measuring physical accessibility to health services. Thus, UNICEF's strategic approach is centered on supporting governments to scale up a comprehensive set of actions for children using robust geospatial methodologies, operationalize specific applications of geospatial data and technologies for health programs. At UNICEF, we aim to increase access to technical support, research, knowledge sharing, and engagement to boost our own ability and those of partners to support countries in the sustainable use of geo-enabled microplanning. This virtual training series will contribute to this effort by introducing the concept and the process behind geo-enablement of the health information system, programs or interventions in countries, and improve better understanding of what geospatial data and technologies can bring to public health programs and how to geo-enable their health information system sustainably. Please do share your recommendations on advancing geospatial technologies for health development, especially in the Asia-Pacific region and beyond. And with that, I encourage you to bring bold, ambitious, forward-looking ideas throughout the sessions and wish you productive deliberations. Thank you very much, and I hand back over to Sunny.
Thanks, Basil. To proceed, we'll invite the model consultant to technically walk us through the presentations. And basically, we invite Steve Ebene to take the floor and present on the topics. Steve, please.
Thank you very much, Sunny, for the introduction, and welcome once again to everyone to the first module of this virtual training workshop. As Basil has just mentioned, originally the workshop was meant to be for Asia Pacific, but we are a much larger reach today because as of last night, more than 50% of the 360, 70 registrants to the participants are from countries outside of the region. So this is great, and we're happy to welcome all of you for this first module and indeed the other ones. A few things I wanted to mention before we dive into the first session. First of all, I would like to mention the process which took place at the end of last year with the support of the Global Fund and which covered 11 French-speaking countries from the African continent. The reason why I'm mentioning this is twofold. First of all, the process that was followed at that time inspired the present training workshop with a survey that has been shared with you at the same time as the invitation for this training workshop, and also the technical support that will be provided to some countries at the end of these 6 modules to develop an action plan. We will talk about this survey and action plan a bit later today. The second reason is also because this material is in French, and that might be of interest to French-speaking participants on the call today. You have the QR code here to access the workshop material, and Ise with helping me today with the module also post the URL to this workshop material in the chat. So feel free to use that as well. The second thing I wanted to mention is that the training workshop material, so not only the slides, but also all the documents that will be mentioned in the different slides that we'll be referring to, are accessible in a Google Drive folder, for which you again have here a QR code and a URL, which will be also appearing in the chat shortly. So the slides for this first module have already been uploaded in the drive, and the slides for the subsequent module will also be posted there. Each time you will see the Google Drive logo appearing on one slide next to a document, it will mean that this document or this resource is basically in the drive as well. What you have also here and soon in the chat is the link to the glossary of terms that we will be following during this training workshop. And so this is a resource you can consult in case you need to have a better understanding of some of the terms that I will be using. Lastly, I mean, Alexandre already mentioned about this. Each module is being recorded and will be made available. You will receive an automatic email about this, and we will also have a specific page on the Health GeoLab website that will be generated so that all the material shared during this module can be easily retrieved. One more important thing, Alexandre mentioned about the Q&A. I mean, this is the place where you can post any questions during each module. Basically, just please try to remember to put your questions there, not in the chat. That will facilitate for the answer. We have also set a simple, short Google form that you can use either if you feel more comfortable to ask your questions privately, or if you think about something in between each module, you can put them there. And so we will try to answer these questions as much as possible during the modules. You have also another possibility to interact, which is the chat, which we would love to see being used not only for us to share information with you and you guys presenting yourself, but also to share resources and experience that you see relevant to the participants. So please feel free to use it. If you do that, just maybe indicate your name and country, and also any link you might have to this particular resource, if you're talking about an article or a website or all of this, so that this will add additional value to this training workshop. So today's agenda, a quick zoom on it. Today we will really look at introducing the potential of geospatial data and technologies in public health, and also introducing the HIS geo-enabling framework that we developed and have been implementing in countries to geo-enable the health information system, programs, or interventions. We'll do a short break also, certainly after 1 hour after the first session, for everybody to stretch, and myself most probably rest my voice a little bit before we finish with session 2 and 3. Once again, this is not a GIS training, right? But really training aiming at kind of introducing all those potential, and also how you can use the HIS geo-enabling framework as well as the HIS geo-enabling toolkit to identify where you stand with your own health information system, program, or intervention, and also how to come up with an action plan to basically fill potentially identify gaps. Okay, so during this first session, we will look at the geographic dimension and the potential of geospatial data and technologies in public health. Two definitions of public health I like to use. There are many other ones, but more importantly are the three main functions attached to public health, which are risk assessment or assessment, depending on the bibliography, policy development, and also the assurance of services. All these three main functions, as I will illustrate now, have a strong geographic aspect. So starting with risk assessment, as a function of public health, these particular function basically involve analyzing hazards, vulnerabilities, as well as capacities to react of the population, as well as infrastructures and services. And these population, infrastructure, and services are the most at risk of experiencing losses or damages, are located in geographic areas where the hazards and vulnerability are the highest and where the capacity to cope is basically the lowest. And this is independently from the type of hazard. So because of this, geography has an important role to play when assessing risk, and as well as identifying these areas where the risk is most likely to be the highest in case of a disaster event. It's also geography of the risk is also at the origin of, we can say, of modern epidemiology. Most of you, if not all of you, of course, are certainly familiar with John Snow identifying the source of a cholera outbreak in London back in 1854. This is maybe the maps that has been the most seen by all the health sector across the globe. And so what he did is by tracing and mapping the cholera case in the area, he has been able to identify which water pump was actually at the origin of the outbreak, and by stopping the pump, basically also stopping the outbreak. Now, more recently, if you look at the way geographical granularity of interventions aiming at eliminating communicable disease like malaria evolve until the elimination stage, you understand, of course, the importance that geography still plays today in epidemiology, and also the need for having access to data that is very disaggregated, and also applications that allows to identify, monitor, and also ensure that interventions are basically taking place in the right area to reach this different level. Now, if we look at the third function of public health, I jumped to the third one before the second one in the initial list. So to be in the position to analyze physical, or what we call geographical, access to healthcare requires to be considering certain numbers of factors that can be easily combined only if you use geography as an integrating platform, right? If you look at all these different factors which are here on top of the slides, and you want to kind of take all of them into account in traditional ways of analysis from a statistical perspective, it's very difficult. But from the moment you look at the geographic dimension of these different elements, it becomes possible to take all of them into account to analyze how physically accessible services are to the target population. Like for risk assessment, because of this capability, there's a strong geographic aspect to therefore analyzing and ensuring the access to health services. And considering this geographic aspect allows actually for a more comprehensive, and I would say systemic, right, like in a system approach to universal coverage. And in these regards, you might be familiar with the Tanahashi framework, which was published in 1978. framework that describes how you lose part of the target population for a specific intervention as you go along the process of service provision to reach the effective usage of this service. And in this framework, the first 3 layers have a strong geographic dimension, as you need to know the following to reach such an effective coverage. First of all, the spatial distribution of the target population. You need also to know the number and spatial distribution of your services. That's the availability coverage layer. And then the third level is to make sure or to look at how accessible these services are to the target population. So that's the accessibility coverage layer in the framework. So this highlights really the foundational importance of geography in relation to accessibility to health services. Last but not least, the development of policies benefits from the result, of course, of the risk assessment and the accessibility analysis that were just described. At the same time, maps that can be generated out of this analysis and other ones are, of course, very powerful media to help visualize and analyze the situation in a country in relation to specific public health problems. And as such, these maps can support decision-making and policy development. To give a concrete recent example, which also demonstrates the importance of research in this area, back in 2015, 2012 to 2015, the opportunity to conduct an accessibility analysis to emergency obstetric and neonatal care services conducted by WHO, which lead to a set of publications that followed a few years after, and together with a large number of in-country implementation, have been at the origin of the methodology that UNFPA has been using to improve access to EMOC services in countries by developing a national network of maternity units. And just recently, all of this led to one of the indicators, the indicator set for one of the targets of the Ending Preventable Maternal Mortality, the EPMM strategy, to be based on these same accessibility analysis. So we have here an example on how slowly these methods and the growing, let's say, improvement in the quality of the geospatial data and also the development of geospatial technologies have led to the definition and now implementation of an indicator that can support policy formulations in countries. So to summarize, geography clearly plays an important role in public health, as demonstrated by the strong geographic dimension of its 3 main functions. So this is done by first providing a neutral, what I will call a neutral platform for the integration, visualization, and analysis of data coming from different sources. And at the same time, it provides also a tool that supports geographically based decision-making, and therefore this more systemic and systematic comprehensive approach to solving public health challenges. So in view of these, geography is an important dimension that should be captured in any health-related information system. So now is maybe a good time to introduce the other 2 fundamental concepts related to the topics we are covering by the present training workshop, really the base of the first layers, if we wish, of concept. So until now, we have been talking about geography, which is the science devoted to the study of lands and other features, including the inhabitants, right, and the phenomena on the surface of our planet. But then the next level is, not level, but the next concept is the one of geospatial data, which itself correspond to the digital representation of such geography. In other words, it is the digital electronic content we are using, and something we will be covering in detail during Module 4 in a few weeks' time. And then we have geospatial technologies, which are themselves these tools I was mentioning earlier that are used to analyze and/or model geography and geographic phenomena in a digital form. It's important here to emphasize that there's more than one technology, which is really fundamental in public health, which is the reason why you will always hear me referring to geospatial technologies, actually, and not only GIS like we hear very often, because GIS or Geographic Information System is one of those technologies. It's maybe the one being the mostly used, but as we will demonstrate during the workshop, the other ones have also a very important role to play. And Module 5 will be dedicated to these technologies. So the proper management and use of geography, geospatial data, and technologies contribute to the digitalization of the health system. Now, if we look at the most important programmatic use case of geospatial data and technologies in public health, we end up with the list here, and this is a slowly growing list, but most of the use case today remain at the level of using these data and technologies for planning, for in relation to communicable vector-borne diseases, immunization, and emergency management. You have here a list of what geospatial data and technology can contribute to for each of these programmatic use cases. But what we're going to be focusing a bit more today are these 5 main applications of these data and technologies that are supporting this use case. So georeference master list, thematic mapping, population estimation and spatial distribution, geographic accessibility modeling, and GNSS navigation and tracking. So we'll go through each of them in more detail in a minute. But before that, I wanted to present these slides, and those who have completed the HIS Geo-enabling level assessment survey might recognize here the list of the 22 health system challenges that are coming from WHO classification of digital health interventions. Challenges that are listed in the questionnaire I was mentioning. And what we have done here is to link those 22 health system challenges with these 5 main applications of geospatial data and technologies. And so what you can see is that one, and sometimes more than one, of these applications can help address all these challenges. So let's now describe in more detail each of these applications, these 5 main applications, starting with georeference master list. So a georeference master list is the unique, authoritative, officially curated by the mandated governmental agency, up-to-date and uniquely coded list of all the active and past active records for a given type of geographic features or object. What I mean by geographic features is, for example, facilities, administrative units, or villages. Such master lists are meant to only contain specific data elements, allowing to do the following for each of the records in these lists. First of all, to uniquely identify each of these records, right, through a unique identifier and or a name, to classify them, for example, by type or ownership, to locate them. There are different ways. That's the geographic component of it. That's the georeference aspect of those lists. And then when it applies, to contact those entities or features This applies particularly to infrastructures, right? Having the name of the head, phone number, email address, or for example, the head of the health facilities. Any other data elements is what we consider as being programmatic attributes, and we see being managed outside of the master list. Now, these georeference master lists play a critical role in the data to information products continuum. And this simply because any data or any piece of information as well is attached to a specific geographic feature or specific locations. So the master list allows to link the two, right? There's data with its corresponding geographic features through the use of a unique identifier that is associated to each of them. This is what allows them to generate data, information, and information products of quality. At the same time, and even more importantly, these master lists are contributing to ensuring data and information product quality across the 6 dimensions of data quality that you have here: completeness, uniqueness, timeliness, validity, and consistency. As such, these lists, among other things, help reducing duplication of efforts and therefore saving cost by maintaining only one list, which is used by everybody instead of several ones, and also by supporting data interoperability and collaboration across partners. They also help promoting innovation and data use. Last but not least, and this is one of the most important parts from a quality perspective, they provide the denominator for the implementation of any programs or intervention. So the list is the elements that will allow you to know exactly how many health facilities you have currently operational in a given district, for example. You have here 2 examples of these georeference master lists for the Philippines, for which you have the URL in the respective banner. You have, first of all, the one for administrative units, which is maintained by the Philippine Statistical Authority. So you have there and updated on a quarterly basis all the administrative units of the country down to the 4th subnational level. That's more than 42,000 of these entities as of the 31st December of last year. And also the master list of health facilities, which is maintained by the Department of Health, which is also updated on a regular basis. And that's also a very high number of facilities, 40,000 of facilities in this master list as of April earlier this year. So you can invite you to have a look at them after today's module, if you wish so, to have an idea of how these lists look like and the type of information they contain and how they can be used to support your activities. Now, the use of geospatial data and technologies to estimate the population and its spatial distribution is a very large field of work. So instead of trying to summarize this in a few slides, I found the following video, which has been prepared as part of the implementation of the Grid Tree initiative. And I just would like to run the first 1.5 minutes of this video to introduce the topic, as this will make a much better work than these slides. You can then consult the rest of the video at your own time to have an idea of the method that is being used and also the kind of applications you can do out of this kind of data set. So let's see, hopefully this is going to work. We've been testing this.
Knowing where people live and the characteristics of these people, such as their sex or age, can be essential for a wide range of applications. Information on how many people live in a certain area can help with allocating resources appropriately across a large population, be it for vaccination purposes, education, or other essential services. To provide countries with accurate and relevant high-resolution population data, Grid 3 can estimate populations with methods that are fast, resource efficient, and do not necessarily rely on census data. Modelled outputs take the form of gridded estimates on grid cells of approximately 100 metres by 100 metres across the area of interest. Each grid cell contains an estimated count of the population, with an associated value of statistical confidence in that estimate, meaning a corresponding interval of likely values. Gridded estimates allow users to get a fine-grained understanding of population density variation across a given region. The value of the approach is that it can estimate population for areas that have little or no reliable population data. This could be due to a number of factors, such as, for example, conflict and security in the region, the sheer size of a region, or inaccessibility to survey teams, etc.
Okay, so I invite you to look at the rest of the presentation at your own time. It's very interesting things. I see there are some questions that start to pop up. We'll look into this at the end of this session, just a few more slides, and we'll take the questions. The third application of geospatial data and technologies consists in using advanced modeling approaches to assess and improve geographic accessibility to the health services, including where to locate those services, as well as optimizing the routes to be followed to deliver health services or resources in the most cost-effective way possible. So when it comes to the first part, the geographic accessibility and service location, this brings us back to what I was mentioning earlier in relation to the functions of public health, right, aiming at ensuring proper access to health services. I will just therefore mention that this is an area of work that continues to grow, which is illustrated not only by the continuously growing number of publications on the topic, but also a growing number of new applications being developed. And in a way, it makes sense because accessibility to health services will concern any health program. And therefore, this is a very good use case in order to be looking at using geospatial data and technologies in countries. When it comes to route optimizations, specific algorithms are being used to determine the optimal routes to be followed to deliver those resources or services based on multiple factors, such as those who are listed here. The benefits that are sought through this type of exercise are to reduce costs, save time, improve resource allocation, and also reduce carbon emissions. The fourth application deals with the use of Global Navigation System, GNSS. Actually, people are generally used to the term GPS, Global Positioning System, but it's not the only one system now that is being accessible to the public to navigate, track, or locate something. So we'll talk about this in more detail during Module 5. Finally, the most used application of geospatial data and technologies, which is thematic mapping, and which consists of combining different types of data on a map to convey information on a specific message having a geographic dimension. These maps have been used for a very long time, bring us back to the map from John Snow. And while static maps continue, of course, to be used, especially in areas where connection to the internet might still be an issue, the technology nowadays allows to use this map more and more in a dynamic ways as part of dashboards, for example. Okay, so this is what I wanted to present to you. Let me have a look at the questions that we have in the chat. So we have a question from Dr. Jamil Ahmed. What is the ideal frequency of updating data files? Very good question. This very much depends on the data itself, right? And the frequency at which the elements that this data is representing is changing. It's also, of course, function of the use case for which you need to use the data, which might require for the data to be updated more frequently than for other use case. And of course, I mean, all of that is independent from the resources that are needed to be able to update that data. Oh, I see there's a second part, especially population. Of course, you will wish to have that as soon as possible. I mean, as frequently updated as frequently as possible, depending again on the use case. But this is one of the most difficult data to update. And the reason why these GIS-based methods that were mentioned earlier to estimate population distribution have emerged and now taking an important role. I'm also being mentioned that there might be someone with a raised hand. Yes. Vidyan Abubakar, I will allow you to, you should be able to talk now. You should unmute on your side. Vigdam. I cannot hear you. Okay, we'll take the question again later in case. There's another question in the chat. What is the clinical utility of thematic mapping? That's an interesting question. Clinical in the sense of the delivery of healthcare services. Is that what you're meaning? That's a question for Gloria Ogia-Miren. Or are you talking, because there is another thing that crossed my mind, which we have seen, but not very often. There are some applications which are actually, I mean, purely from a, let's say, I would say a medical perspective, I've been using a map of the body as a way to serve as an entry point, for example, for sharing information or giving access to knowledge and information to interested party. Okay. So the first one, I guess, or maybe the second one, I hope I've been there. So two possible use, definitely showing the spatial distribution of specific conditions that might lead to identifying if the corresponding service or clinical service is located in the appropriate area. That's one application. Another one purely on the I will say illustrative side, so not a real map in the sense of the surface of the Earth, but using a map of the body as a way to be an entry point for basically accessing specific knowledge on specific organs or conditions. Let me see if we can manage to get back. Vigdam, can you hear me? Can you unmute on your side? You have the hand raised. I can still not hear you.
Steve, otherwise, there's another question in the chat. Can we learn more on gridded population estimate?
Sure. Thank you, Alexandre. We'll put the link to the grid tree initiative. Ise, if you can, I think it's www.gridtree.something, and put that in the chat. That's a good entry point for looking on this. The other resources for which Ise can put the link is, of course, the World Pop initiative at the University of Southampton. Ise could be also kind of putting the link in there. Another very interesting discussion that could be the subject of a full module from Dr. Jamil Ahmed again, how to map migratory population, which is seasonal migration. So it depends if we are talking about live mapping, right? Are you talking about tracking those populations, or to take a specific snapshot at a particular moment in time? There are methods for both, right? The latter is easier, especially if those population tends to have specific locations, so tracking, okay. But there's ways also, generally what we do, like when you have nomadic populations in countries, they tend to have specific places where they find themselves during a particular season. So that's a way potentially to map those populations. When it comes to tracking, and again, I think it's in module 5, we're going to talk about this in more detail, but there are devices with the consent of the concerned population that can send basically a specific signal on a regular basis, a signal that can be then captured and give a location and capture in systems that will allow to track basically where the populations in question find themselves at a particular moment in time. This is the same approach that has been used for tracking vaccination, for example, monitoring, tracking vaccination in countries. And this is also the method, the same method you see when you even have in sports. I mean, just to get out of health a little bit, when you have these, for example, sailing race, and you can follow almost live where each boat finds itself during a race across the globe, for example, find itself. So this is the same, similar type of technology. So a small device capture regularly the position and allows to track this. Another question from Jima. What has been the experience of the graded population estimate in other countries? That will be a question to ask those, specifically the people at World Cup and DITATEM to kind of see and share the experience. Do you have a particular report in relation to this work? And also issues of capacity to do population modeling is an issue as we rely on other bodies like World Cup. Yes, this is definitely something we will touch upon also, is the question of technical capacity. There are different, I mean, all the application I've mentioned now and the example of use case that I will present to you in the next session require different level of technical capacity. Of course, the, let's say, lowest hanging fruit is thematic mapping, and then you have spatial analysis, and then you have spatial modeling. These are the most advanced type of method to deal with, and the modeling of population falls in that category. So it requires indeed a higher level of technical capacities, which is more difficult to maintain in countries, and the reason why even us rely on other bodies like World Cup most of the time. Okay, thanks for Laila for answering the question in the chat. Yes, indeed, a smartphone can be used for navigation, but only if they have a receiver, right? We'll touch upon that on module 5. So if your phone doesn't have a GNSS receiver, so kind of an antenna to receive the signal from the satellites, then it cannot be used in that purpose. Okay. Any other questions? Let me see if we still have, we have another raised hand. No, not anymore. Okay. Okay, if not, then I propose we have a 10-minute break. We'll restart at the hour or half of the hour, depending on the country where you are. So in 10 minutes, we will go and restart for session number 2. Thank you. Talk to you soon. Okay, welcome back to the first module of this training workshop and the second session, during which I will present to you a selected number of examples of application of geospatial data and technologies in public health. These examples are organized according to the use case I was mentioning earlier, the 4 use case, right, during the first session. And this is definitely not an exhaustive set of applications. And I therefore invite all of you to post other examples in the chat, if possible, with the link to related material, right? If you might have some report, articles, or even presentation or website. So please don't hesitate to share that with everybody. So let's start with planning, which was the first use case, main use case for the application of geospatial data and technologies I was mentioning earlier. And here with an example of accessibility to primary healthcare analysis conducted in Vanuatu. Okay, I've been told that the slide deck did not change. Sorry, there's a small issue on my side. Just 2 seconds. I have a problem with my Zoom. I'm afraid I'm going to be kicked out of Zoom.
You, Steve?
Yes, Alexandre.
How can I help you? What's the technical issue?
The whole thing froze. It's not responding. Okay.
Oh, it froze. Okay. Can you stop sharing?
No, I cannot even stop sharing. So I'll get out and reconnect. Just 2 seconds. Sorry for that, guys.
No worry. We're waiting for you. Thank you. Thank you, everyone, for your patience.
Thank you.
Okay, you can go ahead. Thank you.
Thank you. Sorry, everybody, for that small technical issue. So I'll restart where I was earlier. I was talking about this use case in Vanuatu, where we conducted an accessibility to primary health care analysis. This is a use case that benefited from 4 of the 5 main applications of geospatial data and technologies: georeference master list, spatial distribution of the population, geographic accessibility, and thematic mapping. So what's interesting here, apart from the fact that the analysis allowed to provide possible scenarios to improve accessibility to primary health care, is that the data that has been improved through the process, starting with the master list of health facilities, so georeference master list of health facilities, was used to conduct a rapid impact assessment at the time Cyclone Harold reached the country back in 2020. So this is a very good example of the importance of not only following good data management practices to ensure the quality of the data, but also thinking beyond the project to ensure the maintenance and the regular update of the data and information that is being collected during the implementation of a project. And these to support the largest number of use cases possible in the future. And this is something we will come back to these key elements of sustainability and data quality during the module 4. Another example at the border between planning and communicable disease, right, or vector-borne disease here in this case, because it's malaria, sorry, is the work done in the context of the Southeast and Southeast Asia Community-Based Trial Network, CCTN. Once again, an accessibility analysis that has been conducted after having a good understanding of the referral pathways, followed by patients in need for malaria treatment. But in this case, what's interesting is that the accessibility analysis has been conducted at a more micro level than in the case of Vanuatu or what we see for other countries. And this has been done to guide the spatial distribution of village health workers to support malaria referral. And in this case, the 5 main applications of geospatial data and technologies have been used as GNSS-enabled devices have been used to collect the geographic coordinates, not only of health facilities, but also villages in the field. One more example in relation to planning, this time in relation to emergency obstetric care and emergency obstetric and neonatal care, and the implementation of UNFPA's manual for developing a national network of maternity units in countries. So the example you see here shows the result of the prioritization exercise, which has been conducted last year in the district of Garut in Indonesia. And what you can see is that thanks to this exercise, it has been possible to reduce the number of EMOC facilities from 37, sorry, you have 30 designated BMOC, 6 designated CMOC, and 1 fully functional CMOC. So 37 EMOC facilities to 16 facilities, right? 12 designated BMOC, 3 designated CMOC, and 1 fully functional CMOC. And by reducing by more than 50%, actually the original number of EMOC facilities, still keeping a population coverage above 90% for travel time of more than 2 hours. I mean, for 1 hour, we can see that the percentage of coverage dropped from 82.5 to 77%. But when you consider 2 hours, which is generally the time we looked at from an emergency obstetric care perspective, we remain above 90%. So again, this is a good example, a good use case that benefited from 4 of the 5 main applications of geospatial data and technologies. GNSS-enabled devices have not been used here because the location of the health facilities was already available from the master list. A last example for planning, again, the border with vector-borne disease, another malaria-related example in Bangladesh, this time in relation to the optimization of G6PD diagnostic facilities in Bangladesh. So the main benefit here, like for the other accessibility analyses that were conducted earlier, is that you can test different scenarios, right? Until you find the most cost-effective distribution of your services, like it is the case here to introduce a new type of testing. So again, for application of geospatial technologies here, but this time we did not use the spatial distribution of the population capability, but because the population data was directly collected at the village level. And therefore, there was no need to use a GIS-based method to estimate such distribution of the population. We're switching now to fully switching to communicable and vector-borne disease. which was the second main use case mentioned earlier. And I just give one slide here to present a few more examples of thematic maps included in publications here. Of course, thematic maps are the final products very often that is generated for any of the use case I'm presenting during this session, right? Either static or dynamic thematic maps. But what you have here are, of course, static maps included in the publications, one from the Philippines regarding dengue, another one for Laos, PDR in relation to influenza, and the last one for Vietnam in relation to HIV/AIDS and TB. What is maybe more interesting from a vector-borne disease perspective is the work that has been conducted in Cambodia by the National Center for Parasitology, Entomology, and Malaria Control, CNM, with more support. And this using geospatial data and technologies to stratify malaria risk at the village level. So to be able to do this, CNM had unfortunately to spend a large amount of time and resources to check, correct, and update the existing list and location of villages, as well as health facilities and the boundaries of operational district as well. And ideally, this data should have been made available by the government entity having the curation mandate over it, right? So not only made available, but being of quality and just being used by CNM to support its intervention. And actually, this is something that is happening still in many countries to really be able to do this kind of work of quality, like the work that has been done by group mappers for the previous use case in Bangladesh, and the one I will present in the next slides. Programs have to, by themselves, adjust and improve the quality of the data they need to operationalize these use cases. Well, these are good illustration of the reality observed in countries, and actually one of the reasons for developing the HIS Geo-enabling framework that we'll present in the next session, and also for implementing this framework in collaboration with other line ministries who have the responsibility over such data. So now, coming back in the meantime to this use case, thanks to the work that has been done on this data and its combination with other source of information and a tool that has been developed by CNM and integrated in their malaria information system, it's possible now for CNM to stratify malaria risk down to the village level and to use that to guide their intervention. So this particular use case only used two of the applications of geospatial data and technologies, georeference master list and thematic mapping, because the method used to locate villages did not require GNSS enabled devices. But of course, this is an example where the big impact has been reached, and thanks to the use of those data and technologies. Same approach has been implemented also in Bangladesh for the same purpose. But in this case, the analysis has been complemented by physical accessibility analysis to also have, again, an idea of how accessible malaria-related services were to the population. So here we have a complete mapping of all the settlement, so identification first with the official local authorities of the settlements available, existing in a specific union, I think here, and then the mapping of those settlements using a specific approach based on satellite imagery, and which allowed to not only therefore have this fine-scale malaria risk and hotspot mapping, but this physical accessibility analysis. So we have covered planning, communicable and vector-borne disease. The next We can switch now to immunization and 2 projects supported by UNICEF to geo-enable micro-planning in countries. Of course, the response to COVID-19 has contributed to a growing interest in using geospatial data and technologies in this context. But this first project actually took place before the pandemic. And if I'm not wrong, this initiative is the first of its kind, at least within UNICEF's support, to be implemented in Myanmar, and has been used for other projects since then. So starting with only a few townships, the project then grew up was scaled up to cover 49 of them at the end of the program. And what's interesting here is that the process, first and foremost, helped to define a new classification of communities that was used by the expanded program for immunization in the country. And this was one of the biggest impact. Was actually not necessarily, I mean, of course, the maps have been very useful, but by defining this geographic context of routine immunization, it has been, and defining this new classification of EPI communities has allowed to basically avoid for certain types of settlement to be missed during the development of the microplan. So this has really been used as the foundation of the process, and using this, it has then been possible to establish, update, and complete the master list of these EPI communities, because now they were more clearly defined, but also doing the same with vaccination posts and the health facilities. And what has been done, which was a very interesting exercise in the context of this project, thanks to the very large network of midwives, which are basically operationalizing the micro plans in the country. The boundaries of each of these EPI communities has been drawn by hand through a crowd mapping exercise by these midwives. And last but not least, what basically resulted from this exercise was the need to modify some of the forms and the associated material that was guiding the development and the implementation of microplans in the country, sorry. So really, when we think about geospatial data and technologies, we think mainly about maps, but there are other steps, and we will look into that during the next module. There are other steps that are also before the creation of these maps that are also contributing to improving the impact of programs just by having a much better understanding of the geography of the program itself. The second project, which is very similar to the one implemented in Myanmar and which benefited from that first project implemented there, is the one which has been implemented in Mozambique. So this is also supported by UNICEF. Again, the project helped to clarify the geography of routine immunization in the country, which was really unclear. Actually, the forms that was using for microplanning was containing different type of geographic areas, which made the collection of the information confusing and not sufficiently clear to ensure that, again, all settlements, all communities were covered. So once this has been done, again, improvement of the quality of the different georeference master list. We have led to an improvement in the method to estimate population coverage. The previous method was basically introducing a lot of uncertainties because the areas of responsibility of each vaccination post were overlapping. So we came up with another method that allowed for these areas to be contiguous and therefore not overlapping, and this led to the generation of much more useful micro-planning map, digital micro-planning map, as well as tables that were summarizing the population basically living in each of those areas for different travel time. So that was allowing the people in each district to kind of identify if some vaccination points were needed to be moved, removed, or new points to be added to have an optimal coverage of the population. One important additional step compared to the project in Myanmar is that we reached the point where it was possible to deploy an IT solution, what we call a common geo-registry, to host, maintain, regularly update, and share the different master list and associated geospatial data. So this again, to facilitate the regular update of this information, as well as its use in a larger number of use cases. As you certainly guessed, this project also benefited from the 5 application of geospatial data and technologies. One last use case related to emergency management, specifically in the context of health, in the health context. In this case, GIS-based methods have been used to spatially estimate the vulnerability not only of the population, but also of key infrastructures, first-line responders, and health facilities, and then also estimating the risk for them to experience damages in the case of infrastructure, and therefore not being operational in case of a disaster, or when it comes to the population of experiencing losses in the case of these same disasters. So this kind of exercise allows to define preparedness and mitigation measures and develop plans that will reduce such risk before a disaster. So you have here example for North Macedonia and Kosovo. In North Macedonia, we were looking at hazard, the hazard being earthquakes, so seismic hazard, and in the case of Kosovo here, we have been looking at floods as the hazard. Few more slides to mention about some documents that contain additional documented use cases, starting with Gavi's landscape analysis on how to improve immunization coverage and equity through the effective use of geospatial technologies and data. That's one document. We have a set of use cases that are summarized. You have longer use case in terms of their description in the Geo-enabling micro-planning handbook, which was co-authored by WHO and UNICEF in collaboration with other partners, and where you find micro-planning related use cases for COVID-19, malaria stratification. It's the Cambodia example I mentioned earlier. Routine immunization, polio supplemental immunization activities, emergency outbreak, measles vaccination, as well as IRS and ITN deployment in relation to malaria. So you have here over 2 or 3 pages some well-documented use case. And then finally, the link here to a series of what we call story maps, which are also based on online geospatial technologies, and which are presenting examples of the implementation of the HIS geo-enabling framework in 4 countries, Myanmar, Cambodia, Vietnam, and Mongolia. And these story maps all contain use cases which are presented under the form of dynamic maps. And so that's some other interesting ways to look at how use case or project can be presented outside of the usual report or article type of media. So this is the last slide for this session. It's a perfect introduction to the next session that will be dedicated to introducing the HIS Geo-enabling framework. But let me see first the question that we have. They should appear on my screen now from what I have selected. So it's going to be easier. Okay, I like the idea of georeference and facility database within a country. Okay. And my question is, can a facility enter data on a daily basis using a computer and tablet or phones? Okay, so that's a much larger topic, but the way I will answer is that there is no limitation today from a technology perspective, in the sense that either off-the-shelf or custom-based IT solution to be able to operationalize what Jesse is describing here is not the main barrier, right? The main barrier will be on the side, of course, of the financial resources to operationalize something like this. As we are talking about live data, maps, and diagrams, there is a question of internet connectivity. There is, of course, the whole question, if here we are talking about each single facility to enter the data, which is the time this will take for the staff in the health facilities to complete the information in these kind of systems, considering that certainly they are already entering a volume of information in other systems, right? But again, from a technology perspective, no limitations. The others are more along the line of what I mentioned. Other question, and I'm sorry for the pronunciation of your name. Musliuddin, hi, can GIS be used to map, track HIR availability in PHCs? Yes, again, there is, from the technology perspective, no issue. This will be a question of the data entry capabilities, right? For collecting this information. When it comes to displaying this information on the map, from the moment you have the geographic location of those facilities, PHCs, they can be definitely displayed on the map, either in a dynamic system or printed or saved in a PDF file on a regular basis. Okay. Okay. The challenge I face is my location is high HIR attrition rate. Okay. Yeah, definitely. I mean, I will say it's not necessarily GIS. Again, it's geospatial data and technologies can definitely help in that context. The operationalization of all of that, that will be the issues. Question from Lemmy Kembede. Do you have a YouTube channel for further reference? Further reference about which topic? Can you please specify, and then we can look, we'll be able to have a look and see if we find some YouTube channel about this. Okay, I think these are all the questions in the Q&A. Let me see, there's no hands being raised as far as I see. Okay, so we're just perfectly following the schedule. So if that's everybody agrees, I will switch to the last session for today, which is the introduction to the framework, the HIS Geo-enabling framework. Okay, So, as I just mentioned, we'll introduce this framework, and the first thing is of course, what is to answer the question of what is a geo-enabled health information system. I mean, you have been hearing me using this terminology since the beginning of the presentation, and you might be wondering what it is about. So a geo-enabled health information system is an information system that fully benefits from the power of geography as the science, geospatial data as the digital content, and geospatial technologies as the digital tools that allows to look, analyze, and model this geography from digital perspective, right? And this is reached through the proper integration of the geographic and time dimensions across the health information system business processes. So the key here is not the tool at the end, is not your final product, right? I mean, of course, this is what drives the geo-enablement of your information system or programs or intervention. And we'll look at that in the next module. But at the origin is really how do you properly integrate these two dimensions across all the business process in your information system, right? So from collecting the data up to visualizing it, analyzing it, etc. And if you think about it, and try to identify, and that's a question to you all as participants. And if you have an answer, please put it in the chat. But can you actually think about one piece of data or information within the health information system that has neither a geographic nor a time dimension, right? So some piece of information or data that is not being contextualized in space and time in your information system. And actually, I mean, I will be curious, let's see if we have some people who can have an answer to that. But contrary to what some of you might have heard around a few decades ago, and which was actually a misinterpretation of a quote included in an article from 1987, everything happens somewhere at a given time. I mean, in this article, they were making reference to the fact, according to them, that 80% of the information used by basically the government was having a geographic dimension. But if you really think about it, everything happens somewhere at a given time, right? Every geographic object, every piece of information is attached to a specific location or an infrastructure or a person that finds itself at a given place at a given moment in time. So as such, properly integrating geography and time in the health information system improve geographically based decision making and provide a more, again, systemic, a system approach, right? It allows you to really look at all the components, all the elements that have an influence on the health status of your population, as well as the location and also the status of your health system delivery network, right? So if you properly integrate geography and time in the information system, again, this is also applicable again to any program of information or intervention, you have this more systemic and systematic, so comprehensive, complete approach to solving public health problems. So what are the benefits, or should I maybe say the main benefits, as there might be other ones, right, of a proper integration of the geographic and temporal dimensions in the health information system, a program or an intervention. There are 4 of them, according to me, and that was published in the ADB brief mentioned here. The first one is, the first main benefit is to be able to contextualize every data and or piece of information coming from different sources in both space and time, right? Is to really kind of making sure that, knowing that each piece of information is related to a particular place at a particular moment in time, which is, of course, something that is key, for example, to disease surveillance, as you need to know if the cases that your system are basically identifying are close to each other, not only geographically, but also temporally, to identify potential outbreaks. So this is the first benefit. The second main benefit is the possibility to use geographic features like health facilities as the common link between data collected by different sources, right? So each source can provide a piece of the information related to that object at a given point in time. And by using that geography as the integrating component, you can have a more complete picture of what you're looking at the level of a district also, for example. The third one is to facilitate trend analysis by taking into account how geography is evolving through time, right? And this is particularly important and useful in countries where the administrative or the health district change regularly, for example, right? And I will show an example in the next slides. And it's important to highlight that these 3 benefits are actually independent from the use of geospatial data and technologies, right? Being able to contextualize data in both space and time, using geography to integrate different information together does not necessarily require to end up on a map, right? This is information that can be useful for you to analyze, visualize also the data from your information system in a table or a graph, for example. And the fourth benefit is itself, of course, the use of geographic information system to create thematic maps, conduct spatial analysis or applications of spatially distributed models, which are going back to the use case I was showing in the previous session. Now, how do you benefit from these benefit capabilities in a way, in a sustainable way? It is by geo-enabling the health information system program or interventions. So just one slide quickly to illustrate the importance of managing the temporal dimension at the same time as the geographic one, right? And therefore not dissociate the two, right? You should really look at geography and time together. So what you have here is the temporal evolution of the districts of Uganda, a part of Uganda, over the January 1st, 1990 and June 30th, 2005 period. By the way, this is an information that is coming from an initiative launched back in 2001 under the umbrella of the UN Geographic Information Working Group, and which is still running. It's called the Second Administrative Level Boundary SALB Initiative. And what we can see here, which is interesting, is this particular district of Soroti was actually been split twice over that period, right? First in 1997, in March 1997, and then in July 2001. And so each time, the district doesn't change name, but of course its geographic extent, as we can see here on the map, changed significantly, and so does the population and any attribute that is attached to this particular district, right? So if you were not aware of these changes and you were having a data set with data from different years and you were just looking at the name of the district over this period, you might not be knowing that this change occurred, and not understanding why suddenly your figures are going up the roof or going down. Because of course the denominator has changed, right? Your population has changed over the time. So this just to remind or highlight that geography changed continuously over time and at a different speed. That goes back to one of the questions earlier about the frequency to update the data, right? So this depends really on the geographic features you are considering. Now, let's look at the vision behind the geo-enablement of the HIS in particular. And the vision is really to pass from the situation you have illustrated on the left, and in which each information system, each program-specific information system maintain and use a different geography, right? So this is not only not cost-effective, but it does also really avoid to benefit from this power of geography, geospatial data, and technologies, because it makes it difficult to enable strong use case that are supporting decision making and planning. So we want to pass to this situation to the one you have here on the right, where all the information system use the same geography. So a common geography over time, which does not only reduce the application of effort and cost, but also take full advantage of geography, geospatial data, and technologies, by really allowing to enable as many use cases as you can imagine and facilitate all of this. So this HIS geo-enabling framework, right? I mean, I hope I've been able to illustrate why there is a need to kind of look at that, and why we came up with this framework, which is composed of 9 elements that must be in place and sustained over the long term, right? For a health information system, a program, or an intervention to be considered geo-enabled, right? So they are represented here under the form of a pyramid, thanks to Rocco, by the way, from UNICEF, who thought about this around 7 years ago. And in this pyramid, you have different stages, each stage supporting the next one to operationalize strong use cases, right? And these strong use cases supporting then the implementation of health programs. I just want to first highlight here that this framework is aligned with the United Nations Integrated Geospatial Information Framework, the UNIGIF, which has been developed and is promoted by the UN Committee of Experts on Global Geospatial Information Management. So this is basically the HIS Geo-enabling framework is the health version of this larger cross-sectoral framework. And so the work which is done by implementing this framework in the health sector allows to directly connect with the IGIF. And the other thing also I wanted to mention is that in connection to the previous slides and the vision of the HIS geo-enablement, right, is that the vision itself covers or is connected to the upper part of the pyramid, right? The 2 first stages are really here to operationalize and sustain that vision. So the vision is really at the technical level here at the top, while the framework looks really at also operationalizing all of this. Also, one slide to show where the 5 main applications of geospatial data and technologies plug to this the framework pyramid. So apart from the georeference master list and the collection of geographic coordinates, which are also key to the core data stage of the framework, right? The master list and associated hierarchies and geospatial data in the common georegistry. All these applications are really there to enable the use case, right? So the framework really allows, once again, to put everything in place that is needed to implement strong use case and sustain also this strong use case on the long term. You have here the complete spelling of each element of the framework that are organized according to the general order in which they can be considered for implementation. We will go through these in more detail during module 2. So I will just emphasize here the importance of good data management practices, once again, right? Which drive the use of the appropriate geospatial technology. It's not the other way around. In the framework, the technology doesn't drive, technology support, right? And as you will see tomorrow, that's not the entry point to the whole process. So we'll talk about all of this in module 4. What we have also done for each element of the framework is to define specific objectives and benchmarks to be reached to consider for the HIS to be considered as geo-enabled. And so these benchmarks are used to assess the current level of geo-enablement in countries and also for developing an action plan aiming at filling the gaps that have been identified. So those who have completed the HIS geo-enabling level assessment survey might recognize this benchmark. What you have here are those benchmarks for the first 4 elements of the framework. And here are the ones for the other 5 elements. This table, by the way, is one of the tools included in the HIS Geo-enabling toolkit that I will describe in more detail in a few slides. Now, why did we come up with this framework? Now, more than a decade ago, much more than a decade ago, 1.5 decades ago, after working for a long time with countries and realizing that something was missing to ensure the long-term sustainability of the management and use of geospatial data and technologies in countries. So we had a sense about what was missing. We came up with these different elements, which were published in this ADB brief that you have here. And that got confirmed back in 2017 when we conducted the first HIS Geo-enabling survey in Asia Pacific with the support of the Asian Development Bank. So this survey covered 13 countries from Asia Pacific and used a questionnaire similar to the one being used now to conduct this kind of rapid assessment. What's interesting here is the result that indicates that all countries had received some form of GIS-related training, right? And not only GIS, but also field data collection using GPS device. Most of them have been having access, a regular access, a daily access to a GIS software to generate thematic maps, less to conduct spatial analysis or modeling. So these are the most greenish area. But then what we can see is that all the other elements show significant gaps across all the 13 countries. And these are the elements that were guaranteeing, first of all, the quality of the data, as well as the effectiveness and long-term sustainability of the use of this data to generate information products, right? So very limited resources, no policy, all the elements that ensure the quality of the content, data specification, standards and protocol, master list, ongoing, not finalized, and then governance structure and vision also, of course, missing. So that confirmed that there was really a need to go beyond the usual kind of trainings that we were seeing in countries where staff from the Ministry of Health were told to collect coordinates in the field and how to use a GIS software to create thematic maps. And interestingly, more recently, the assessment conducted at the end of last year for 11 French-speaking countries that attended the training workshop I mentioned at the beginning of the module shows a different picture, right? So this is based on the new version of the questionnaire, which now allows to differentiate also the information by program And what we can see here is that across countries, there has been already implemented or being implemented use cases, right? So they were having projects like project looking at physical accessibility to certain services being implemented, but there was really a significant gap remaining across all the other elements of the framework. So interesting thing, everything is basically driven by real implemented use case, but all the elements that will ensure the sustainability beyond these projects were not in place, especially when it comes to all the elements supporting the stage one, right? The institutional framework, financial resources, policies, governance, and even the vision. And so apart from the fact that we hope to generate the same visual for Asia Pacific now in the context of the present workshop, and I will come back to the end of the session, we see here the gap that exists. And we think that's partly the reason why we don't reach long-term sustainability and why we have developed and been promoted and implementing this framework. Quickly, just want to mention that the framework, the HIS Geo-enabling framework, is included and sometimes even providing, I would say, the spine or the structure of several guidelines, including the three that are mentioned here, right? And that the framework has also been used by UNICEF, Gavi, WHO, and the Global Fund to support the management and use of geospatial data and technologies in countries. These three documents are complementary, right? They have different purpose. They're looking at different aspects of the whole HIS Geo-enabling framework. And even if they have been developed in relation to immunization or microplanning, they are directly applicable to other programs or interventions. You will find in those documents, I mean, you will find the pyramid or you will find it in the text. So you find the mention of the framework as well as the interpretation of the implementation process associated to it in each of those documents. In addition to that, in those documents, you find additional useful tools that are supporting the geo-enablement of the health information system in countries. You might recognize here the link between these health system challenges and the application of geospatial data and technologies I was mentioning earlier. So this is coming from those documents that was generated as part of their elaboration. In this particular document from UNICEF, which is a guidance on the use of geospatial data and technologies and immunization programs, you will find additional useful tool supporting material that can be contextualized for the health programs and help with the implementation of the HIS Geo-enabling framework and process. And in Gavi's rapid guidance for investment planning, you have very useful consideration to estimate the cost and the timeline for the activities aimed at strengthening the geo-enabling environment when you are basically implementing the framework and the process in relation to immunization. But again, this can be transposed to other programs. And so something you can see. I'm just showing again the slides with the implementation of the framework in countries because it provides you with concrete examples on how the process is being implemented. But I just would like to mention that, interestingly, in the case of Myanmar, this is what we hope to see happening in countries, is that the implementation of the HIS Geo-enabling process and framework at the HIS level, so in the case of Myanmar, actually triggered and supported the geo-enablement of the immunization program, right? So the work that has been done first as a cost program was establish SOPs, standards, technical capacity, which were then being used, by the immunization program to support their own activities. So this is a very good example of the convergence of efforts and resources that we hope to see being implemented and that we are supporting during implementation of the framework in countries for long-term sustainability. All of these to introduce the HIS geo-enabling toolkit, which has been designed to help countries assess their level of geo-enablement and develop the action plan aimed at filling the identified gap. We'll go more in detail through this toolkit in the next module. But again, this is a freely available resources, and Ise is going to put the link in the chat. Again, seeing some of the questions in the chat, all the slides are being shared, so you will be able to access all these links from the slide. One last slide about the toolkit before the next module, and that's the last slide before the kind of homework for those participants from Asia Pacific. Is just to mention that the toolkit cover both process, provides both the process when you're looking at geo-enabling the entire health information system or looking at geo-enabling a specific program or an intervention. Okay, so this is all about the HIS geo-enabling framework for today. Before looking at answering questions, I just want to mention about this homework, right, which link back to the importance of currently assessing the current level of geo-enablement in countries across Asia Pacific. So the homework is for participants from the Ministry of Health programs units of Asia Pacific to complete the assessment. If you have not already done that, it takes you a maximum of 15 minutes, but it will allow us to make things much more interesting and also serve as the basis to identify which countries will receive the support after the workshop to develop an action plan, right? And so that's the homework for participants from the Ministry of Health. From the other participants from Asia Pacific, please, thank you in advance for encouraging your counterpart in the Ministry of Health to complete the questionnaires. My apologies, of course, for the representative from the other regions. At this stage, we do not have resources to analyze the answers to the survey or provide support for the development of such plan, but you can nevertheless still complete the survey as an exercise for you to have an idea of what this is about and what it requires. This is where we stand currently with the answers we have received. So we had received answer from kind of 13, 14 countries and different programs. Those that are on top the countries for which the largest number of programs units have completed the questionnaire, and they are therefore in the best position to receive the support post-workshop. Now, maybe before the agenda for the next session, let's have a look at the questions. I know we are at the time. I hope those that ask the questions can stay a little bit longer. Can geospatial mapping of behavioral insight for planning of outbreak response? Okay, I understand this as kind of, can geospatial data and technology support outbreak planning and maybe the response to outbreak, right? Both the planning and the response. Definitely, yes. I mean, you have seen in the use case, I mean, the vulnerability and risk analysis can very much be applied to communicable disease or vector-borne disease, right? Identifying what are the areas most likely to see an outbreak happening, where are the vulnerable populations, where are the current resources. So for planning purposes, the prepositioning of resources and commodities can be used for that. And definitely to support the response, if ever all the necessary data and tools are in place in advance, right? it doesn't, it's not going to be possible to set something up on day one of a response, right? This is part of the reason why you want to assess the current level of geo-enablement and start geo-enabling your health information system or program or intervention as early as possible, so that when this kind of event happens, you can basically benefit from this data and technologies. Another question from Esgi: will the webinar also address the risk of geolocalized data? I guess you mean the sensitivities that can be linked to highly accurate or disaggregated data being located on the map. We will touch, thanks for the confirmation. We will touch upon that during the module covering the data segment. I think it's module 4, if I'm not wrong. There is also some resources that can be shared in relation to that. We'll do that at that time. Okay, let me see quickly if we have no hand raised. So I'll just show the schedule and agenda for the next module, which is to take place on July 3rd at the same time as today, and will cover the implementation of the HRS Geo-enabling framework. For those, I know there have been 2 sets of basically invitations that have been shared, and some, the first round was indicating that the modules were of 1 hour each. Actually, they are closer to 2.5 hours. So if ever this appears as being a 1 hour event in your agenda, it will be important maybe for you to adjust that so that you have the possibility to attend the whole duration of it. An additional, okay, question about recommended tool to constantly update the Geo-enabled health information system. We'll talk about that in module 5, right? Okay, that's all from my side. I'll pass the floor back to Sunny to close the module.
Thanks so much, Steve, and colleagues and friends. Thank you for your patience. Thank you for staying with us till this moment. I know it's a little late. We've taken longer than we had expected, but then we apologize in advance and plead that, we see you again in 2 weeks' time. As you could see, this is a series of workshops for which the one coming up next will build upon what we've taught today, and we kindly implore you to join us 2 weeks' time. Thank you, and do have a great of the day. Goodbye.